You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. This is Wellness Hour Live. Today we're talking about the aging face, when you should do something about it, what you need to look for in a dermatologist, plastic surgeon, facial plastic surgeon, if you're going to get some work done. With us, we have an expert on the topic, well known all over the world, Dr. Gregory Keller. Dr. Keller, welcome to the program.
Thanks, Randy. Great to be back.
Now let's talk a little bit about your credentials. Professor at UCLA, what is your role there?
Basically, I have several. One, I have a private practice at UCLA, but the other is I'm assigned to train facial plastic surgeons in aesthetic surgery.
Okay.
And it's a fellowship where they complete their fellowship and then they go on to other universities, academic settings. One of them, in fact, did the first face transplant, so that was pretty exciting. It was very rewarding to do that.
Okay. Now, also people there, I get a lot of questions from our website about the difference between a plastic surgeon, a facial plastic surgeon. What is the difference?
Well,
what do people need to know about a facial plastic surgeon?
Facial plastic surgeons are people who are board certified in facial plastic surgery, an equivalent board to plastic surgery, and basically they just concentrate on the face and neck.
Okay.
So that's a facial plastic surgeon.
But are you double boarded? Aren't you also otolaryngology, head and neck surgeons as well?
Yes.
Okay.
And plastic surgeons are general plastic surgeons. They work throughout the body, and some of them specialize in face or breast or whatever type of thing. So you have to measure a surgeon by his experience, what he does he do it very often, how many does he do, and so forth.
Okay, so what trends are you seeing? I mean, right now there's probably, because of the internet, there's more confusion than ever, right? Do we get laser? Do we get filler? Do we get PRP? So give us kind of a progression of what, when should somebody do something about it? Maybe in their 20s, then their 30s, and their 40s, and their 50s. And I've had people on the show that said, Randy, you could take somebody in their 40s if they start early with some of the technology, with radio frequency, et cetera, that you could stop the aging process, the appearance of aging. So I'll let you take it from here.
Yeah, well, I think there's a natural progression for things. In your 20s, really it's a skin problem and making the skin look good and shiny. Usually things don't sag then, although some people can get bags under their eyes. That's a genetic thing, and there are different ways to address that. In the 30s, then we start to see changes in the eyes. Sometimes eyelid surgery's probably the first thing that women do, often in the 30s.
The skin over the eyes?
Skin over the eyes and bags under the eyes, and that's a genetic thing also. But in that time, lasers and fillers and things like that can tend to work pretty well. Even into the 40s, where we start to see another plateau in aging. And at that point, the middle part of the face often ages. You'll get some wrinkles around this area, maybe a tiny little jowl, and the neck can sag a little bit. And if it's not very much, then high-intensity focus ultrasound, thermy, which is a new thing where you put a radio frequency underneath the skin, can tighten things up. These are things we call the in-between type of treatments.
Before you have to go to a facelift?
Before going to a facelift, yeah.
Okay.
Then what happens in menopause is things add all of a sudden at night. We've been doing RF and we've been doing...
RF meaning radio frequency?
Radio frequency, high-intensity focus ultrasound, laser work for years. One of my good friends was Ted Maiman, who invented the laser, and we had a laser institute.
Okay.
So I think I've been a long time, and I love the treatments, and I think they're great, but they have their limits. The answer is no, you can't stave off a facelift in most people forever, because at the time of menopause, particularly for women, a woman will lose 30% of her collagen in 3 months, and she'll feel like, I hear it all the time, they come in and say, all of a sudden I became invisible. And she really notices all of a sudden that she's aged. And it's in a woman's hormonal makeup to want to look cared for and good. And it's more complex than that. I don't think we have time to go
Women
into
go
that.
to your office and I guess confide in you, spill their guts about their insecurities. Is that right?
Well, part of understanding what to do for a woman is understanding how she feels. And my wife told me that there's a secret to that. You have to listen to women, and I do. And I used to like women, but now I like women. I don't understand them, but I think that listening to them gives you a clue as to what you should do.
Okay. And so for the women that, and people need to know too, this a little bit about you, that your center in Santa Barbara, and you're also at UCLA, that you because you invented the endoscopic brow lift. You're kind of a progressive, not even kind of, you're a progressive plastic surgeon, facial plastic surgeon, that you have all the new kind of gadgets, technology for younger looking skin, right? To do it without surgery. I mean, you have all the new stuff.
We do.
Is that fair to say?
I
you
think
have all the
that's fair
new
to say.
injectables, the stem cell treatments, the PRP, and then you do the facelifts. But there's something you said a little earlier that almost like a facelift was inevitable. What do you mean by that?
A facelift is inevitable.
I mean, sometimes lasers could only go so far, you said,
Yes.
and injections could only go so far, fillers could only go so far. But no matter what, if you live long enough, a facelift.
Well, Maria's a case in point. Maria's a nurse in my office who does injectables, who does lasers, and really tried to stave it off as long as she could. And she made it to 52 or 3, basically without that. But then the inevitable happened, and we did facelift her, and she looks 15 years younger and better, but still like herself. And
That's true. I've seen that woman. I thought she was about 38, 39.
yeah,
And you say she's 54, 55 now.
yeah, she is, but she's someone, typical case in point, who tries everything to avoid it, and at some point, if one wants to look good, it becomes inevitable. And I think
I got it. Okay.
Yeah. But a woman has to be ready for that and accepting of that.
I had a guy on my show, Beverly Hills cosmetic dentist. He said, Randy, if you want to look your best and look great and look young, veneers are inevitable because teeth are only going to look young and white for so long. So if you want to look your best, then you're probably going to have to get veneers someday. Okay. So with you, if you want to look your best and young, some sort of facial surgery is inevitable.
Pretty much.
Okay. But then the question is natural, because there are bad facelifts out there, as you know.
Well, there are two components to natural. One is to restore, I like to say that those look like Picasso's, it looks like somebody did a cubist work. And that's okay because some people want that and they want to look that way, For us, we'd like people to look natural, but the other component of that is to get the job done, to get the jowls lifted, to get the cheek particularly lifted, the neck lifted, and everything looking like it used to, a restorational type of thing.
Okay. Where plastic surgeons, and correct me please if I'm wrong, okay, that they differ in philosophies as far as the aging face. Some are pulling, like back. You are pulling up, more of repositioning tissues to where they used to be. Is that true? Is there truth in what I said?
That's true. And, the patients we sort of self-select. People who want that pulled back look, find surgeons to do it. And people who want a natural look, find surgeons to do it.
But I don't believe that people want to look pulled and tight.
They do, some of them.
It's hard to believe.
Yeah, because they'll focus on one little thing, like, okay, I have this thing, I want it gone. And, that leads to that. They're happy with that.
Okay.
And they find somebody that does that. And nothing wrong with that, because the world, I think, is, at least in the United States, we're free to select what we want.
Do you think we're changing because so many people now have facelifts, right? Yours, and if they go to your website, these don't look like facelifts. They really don't. They just look rested, okay? But do you think our definition of beauty is changing?
I'd like to think so. But I think that there's a variety. If you look at different cultures, there are different types of beauty. Women in Africa stretch out their lips with film cans. So there are different concepts of what looks beautiful.
Okay.
I like a natural look, but I also like somebody to look much younger.
Okay, so how many years younger? Like if somebody's 60 years old?
I think 10 to 15 is a reasonable expectation. Not always, but usually, yeah.
And if it's done right?
Yeah.
Nobody has to know.
Yes.
And that smeared, pulled, drapey look right here that I see all the time.
Yeah. What's
I always think that's the healing process, but you're saying that's the direction of the pull of the surgeon.
Well, the direction of the pull and what he's pulling, basically. You don't want that swoop line. You want things to come up evenly. There are a lot of different aspects to the technique. And as I say, we all self-select for people who want what we do.
Okay. Do you fix facelifts? Is it tough to fix one that's gone bad?
It depends on what's gone bad. Probably the most common thing that I do is take someone who's had really a pretty good facelift but not had the cheek lifted and go ahead and lift the cheek. That's probably the number one revision thing that we do. Too tight is difficult. Too much volume removed or replaced, you need to work with. Hair can be lifted too far, so that needs to be replaced. There are all kinds of things, really.
Okay, so what should somebody look for then in a surgeon that's going to do this?
Personally, I think somebody that does a mid-facelift along with their facelifting process.
Just and what about the minimum? What do you think of the plastic guys that say, I don't? I go, what about technology in your practice? Because our show, we air all over the U.S. and Canada. They'll say, I don't have any lasers, fractionated lasers. I don't do any of that stuff.
That's okay. It makes a difference. We'll use the plasma knife.
But what do you think, though, of guys with this mentality? That they're not, they go, I'm a surgeon. I'll leave that to the derms and I'll leave that to the...
Nothing wrong with that as long as it gets done by somebody. Okay. If you have a hammer, everything looks like a nail is the only danger. So you want to match the type of treatment to the patient that you're dealing with.
Do you think you have an advantage because you have this, all the technology, or most of the technology, I guess?
I feel that it enables me to personalize the treatment that that patient gets and to listen to that patient about what he or she would want to achieve.
Okay. Do you do facelifts on other plastic surgeons or facial plastic surgeons or their wives?
We have.
You have? Okay, good.
And you know that. Yeah.
Okay. All right. Well, listen, I want to thank you for coming on the show. Final message. A woman doesn't like the way she's aging. A man, especially, well, you know what, a word on men for a second. Now, I care about the way I look, right? Like the next guy, okay? But other than Botox and maybe some fractionated lasers, I can't imagine ever wanting to get a facelift because I think it can make you really look odd.
Oh, I think.
And I'm sure there's a lot of guys just like me that no way, no matter what, they won't do a facelift. Well, so what do you say to that?
If you look at our website and our ebook, you'll see men there who look very natural and very good. But you're aiming to something different. You don't want a man to look beautiful. You want him to look restored, youthful, competitive, and like he's ready to go. Andropause is a gradual process, so men usually come around to it much later than women. But probably about a third of our practice now is men, and that's true of a lot of plastic
So the
surgeons.
younger men, like what's the youngest guy facelift?
Well, the youngest man can be 50, but usually we're seeing them in the 60s.
Okay. And with the men, mostly what? The bag under the eye area, lifting?
Same thing, bags under the eye, cheeks, and lower face, but neck particularly.
Neck. But these gels right here, because everybody gets this. This seems to show. I just saw famous. I was looking at Rick Springfield on TV. The guy looks phenomenal. He's got to be 50-something.
Yeah.
And just showing a little bit of gelling right here, just a little bit of that. So what do you do for that? Is that more of a pull?
Could be a filler.
But then he's going to look odd.
Well, not necessarily, or it could be facelifting. Men come to us, the number 1 and 2 concerns with men are lower eyelid bags and neck.
Okay.
Yeah. A little bit of the jowl may not bother a guy, unless he's media or something like that. But if you concentrate on the jowl too much and you look at his pictures, he may have had a little bit all along. Mm-hmm. So you don't want to stretch him so tight that he looks like some of the people.
When I see women with their mouths really wide,
yeah.
Is that from being pulled?
It is.
Too much?
It is, yes.
And is that bad work in your opinion?
A lot of them are very happy with that. So,
you're always politically correct.
No, I have
Keller.
the hardest job in the world, and that's making women happy. And I've never had a woman disagree with that.
Okay.
So a lot of women are very happy because they concentrate on that little area and they want it pulled tight. And when they get that, they're very happy.
Do you warn them? Do you say, by the way, it's not my best choice for you?
Well, we all tend to self-select, basically. So somebody who does that is going to see those women that want that. I usually don't see them.
Because you say you only attract people that want natural facelifts.
Pretty much, yeah. Yeah.
So like a Joan Rivers type.
Yeah.
She likes that,
She
apparently.
does, yeah.
My father, 78 years old, he told me, because I think she looks very odd, right? Who am I to say? He said, I think she looks beautiful.
Yeah.
Okay. But that's not the kind of lift that your goal would not be that type of look.
Is
that correct?
Absolutely correct, yeah. We like it natural, but we like to get the job done at the same time.
But if somebody's 79, 85 years old, can you still make them look natural with a facelift? Aren't they going to look a little bit done?
You can still make them look very natural, yeah.
Where nobody knows they had anything done?
Yes, yeah, definitely, yeah.
Really?
Yeah.
What gives you the most satisfaction? with what you do?
I think making people happy, giving them meaning in their life, that they feel better. I love the Men's Warehouse ad where he said, you're going to like the way you look. And that's the important thing.
Good.
You have to like the way you look.
Good, good.
Yeah.
And, but there are certain people you just can't please. They'll never like the way they look. Is that true?
That's true. And again,
Or you don't attract those kind of people?
not anymore. No, because I don't try to achieve unrealistic goals.
Is that right? Okay, well, Dr. Keller, always a pleasure.
Thank you very much,
And
Randy.
they could go to your website. Here's my number one takeaway, and this goes with an orthopedic surgeon or whatever. You'll know the good ones by their results. So I do not buy it. If they say, oh, it's hard to get photos, I don't buy it. If you can't find a plastic surgeon with 10 at least photos of their facelifts, there's something wrong, in my opinion.
Well,
Am I wrong about that?
well, most plastic surgeons will do a facelift a month, every other month, whereas we're doing 3 or 4 a week type of thing.
So you do 3 or 4. I had a guy one time, Olson, Merle Olson or something, older guy, plastic guy in San Diego. He's retired now. But he said, Randy, facelifting is like golfing. He goes, you got to do it all the time, to stay good. Do you believe that?
I think that's true of any surgery that you do,
Okay.
and anything that you do, really.
So ask the doctor, how often do you do these?
It shouldn't be his first rodeo.
Yeah. I know somebody who was going to get a nasal surgery, and I talked her into going to somebody else. And I said, ask him how often he does nasal surgeries. And this guy hadn't done one for 6 months. So with everything you do, ask, how often do you do it? How many have you done, you could ask?
I think so. You're usually going to know somebody that the surgeon's done, or very often you will, or have heard good things about him. And then, it's just a matter of talking to him. And communication is a lot of this type of work, as I've sort of tried to hint at. You have to see that what you do matches what that patient wants.
Okay, good. You've done a lot of celebrities.
I have over the years, yeah.
How come you don't have pictures of them? I'm just kidding.
That's an obvious thing.
I want to thank you for coming to the show. Always a pleasure. You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.